would say that your first and most important insurance is taking care of yourself.
Amen.
Right? Because then you don't end up in the ER, you don't end up in the hospital, you don't end up at the doctor as much when you take care of yourself. I like to tell people that 90% of your healthcare outcomes or your health outcomes are determined outside the clinic. Only 10% of your health is determined by going to the doctor, doing things like that. And so we focus on that 90% where the majority of our health outcomes are driven. And right now we spend in the U.S. about $4 trillion per year on healthcare.
That's trillion with a T.
$4 trillion. And 90% of that is spent on treating preventable conditions like hypertension, type 2 diabetes, many cancers, these things that we can, if we take care of ourselves, not necessarily have to live with. Right? Just because something is common doesn't mean that it's normal. And it has become common in our community.
Doc, say that again.
Just because something is common doesn't mean that it's normal.
Thank you. That's heavy, man. That's for real. That's people get those two things confused.
Yes.
Yeah.
It's not, people do it, but that don't make it normal.
Yes.
That common is what is going on because everybody's doing it, but it's not normal. That's a fine distinction, and I appreciate you pointing that out.